What happens when a rusty nail pierces your foot? It's not a pleasant thought, but it's a situation that demands immediate attention. Imagine the sharp, sudden pain as the nail punctures your skin and muscle. You look down and see the unwelcome sight of blood seeping from the wound. This immediate physical impact is an alarming experience in itself, but it's only the beginning. The pain, immediate and sharp, serves as your body's alarm system, alerting you that something is wrong. It's your body's way of saying, hey, you need to take care of this and fast. The sight of blood might send a shiver down your spine, but remember, it's your body doing its job to clean the wound and keep the site sterile. And yet, as distressing as these initial effects might be, they're just the tip of the iceberg. The initial pain and bleeding are just the start. The real concern is what might follow. The real trouble begins when bacteria from the rusty nail get introduced into your body. This tiny object, now a potential threat, can carry an array of bacteria, including the notorious Clostridium tetani, the bacterium responsible for tetanus. Tetanus is a serious bacterial infection that affects your nervous system, leading to painful muscle contractions, particularly in your jaw and neck muscles. This infection can interfere with your ability to breathe and in severe cases can result in death. The initial symptoms of this infection may include difficulty swallowing, stiffness in your jaw muscles, and muscle spasms. As the condition progresses, you may experience fever, sweating, elevated blood pressure, and a rapid heart rate. But tetanus isn't the only concern. The rusty nail could also introduce other bacteria into your body, leading to a myriad of other infections. These bacterial infections may cause symptoms such as redness, swelling, and pus formation at the site of the wound. You may also experience pain and warmth in the affected area. If left untreated, these infections can lead to more serious conditions, such as cellulitis, an infection of the skin and the tissues beneath it, or an abscess, a painful collection of pus that forms within your body tissues. And let's not forget about sepsis, a life-threatening condition that arises when your body's response to an infection injures its own tissues and organs. Symptoms may include fever, difficulty breathing, low blood pressure, fast heart rate, and mental confusion. These infections can be serious, even life-threatening. So what can you do if you find yourself in this situation? The first thing to do is to administer first aid. This can help prevent infection and control bleeding. Begin by cleaning the wound. Use clean water and mild soap to gently wash the area. It's important to remove any dirt or debris that may have entered the wound with the nail. Don't scrub too vigorously as this can cause further damage. Just rinse thoroughly and pat dry with a clean towel. Next, you need to stop the bleeding. Apply gentle pressure to the wound using a clean cloth or bandage. Hold it in place until the bleeding stops. If the bleeding doesn't stop after 10 minutes, or if it's very heavy, seek medical attention immediately. After the bleeding has stopped, it's time to bandage the wound. Use a sterile bandage or dressing to cover the wound. This will help keep it clean and prevent bacteria from entering. Make sure the bandage is secure, but not too tight. You don't want to cut off circulation. Now elevate the foot. Raising the injured foot above the level of your heart can help reduce swelling and pain. You can use a pillow or a rolled-up towel to prop up your foot. Lastly, consider taking over-the-counter pain relievers. Non-prescription medicines like ibuprofen or acetaminophen can help manage the pain. However, avoid aspirin as it can increase bleeding. These first aid measures can be crucial, but they're not a substitute for medical attention. Even after providing first aid, it's important to seek professional medical help. A rusty nail can carry bacteria that cause tetanus, a serious infection that requires treatment. Plus, the wound may need stitches or other medical procedures, so remember, first aid is just that, the first step. Always follow up with a healthcare provider to ensure proper treatment and healing. Knowing when to seek medical help is important. Certain signs and symptoms shouldn't be ignored. If you step on a rusty nail, your body may react in various ways. It's essential to be aware of these reactions as they can be indicators that you need to see a doctor. Let's delve into this. Severe pain or bleeding is one such indicator. A puncture wound from a rusty nail can be quite painful, and it may bleed. However, if the pain becomes unbearable or if the bleeding doesn't stop after applying pressure with a clean cloth, it's time to seek medical help. Infections are another potential concern. Signs of infection may include redness, swelling, pus, or a fever. These symptoms could indicate the presence of bacteria, which can lead to serious complications if not treated promptly. If you notice any of these signs, don't wait to see a doctor. Now, if you're a person living with diabetes, you need to be extra careful. people with diabetes are more susceptible to infections and their wounds can take longer to heal. So if you step on a rusty nail and you have diabetes, make sure to see a doctor, even if the wound seems minor. Finally, let's talk about tetanus. Tetanus is a serious bacterial infection that can be contracted from a rusty nail. If your tetanus shot isn't up to date, meaning it's been more than 10 years since your last shot, or if you're unsure when you had your last shot, you should see a doctor. They can provide a booster shot to help protect against tetanus. Don't hesitate to seek medical attention. It's better to be safe than sorry. After all, stepping on a rusty nail is not just a minor mishap. It can lead to serious health complications if not treated properly. So if you're in doubt, make sure to consult with a healthcare professional. They can provide the appropriate treatment and help you on your way to recovery. When you get to the doctor, there are several things they might do. First, they will inspect the wound carefully. This allows them to assess the depth and severity of the injury. The doctor will then clean the wound thoroughly to remove any debris and bacteria. This is a crucial step as it helps to prevent an infection. The cleaning process may involve the use of an antiseptic solution, and while it might be a tad bit uncomfortable, it's an essential part of your treatment. In some instances, if the wound is deep or large, your doctor might need to stitch it up. This is done to help the wound heal properly and minimize scarring. This process may sound a bit daunting, but rest assured, your doctor will use a local anesthetic to numb the area and make the process as pain-free as possible. Now, let's talk about the infamous tetanus shot. If you stepped on a rusty nail, there's a chance you could get tetanus, a serious bacterial infection that affects the nervous system and can cause severe muscle stiffness. If your last tetanus shot was more than 10 years ago or you can't remember when you had it, your doctor will likely give you a tetanus shot. This is a quick and relatively painless procedure that can potentially save your life. And finally, depending on the condition of the wound and your overall health, your doctor may prescribe antibiotics. Antibiotics are used to kill or slow down the growth of bacteria, preventing or treating an infection. It's crucial to take these medications exactly as prescribed by your doctor, even if your symptoms improve before you've finished the course. Remember, every wound and every patient is unique. Therefore, your doctor will tailor your treatment based on your specific needs and circumstances. Medical treatment is essential to prevent complications and ensure proper healing. So if you've stepped on a rusty nail, don't hesitate to seek professional medical help. Your health is worth it. Stepping on a rusty nail might seem like a minor incident, but it can have serious consequences. The immediate pain and potential bleeding may be the least of your worries. Rusty nails can introduce bacteria, leading to severe infections like tetanus, a condition that can cause muscle stiffness and spasms, breathing difficulties, and in rare cases can be fatal. It's important to take swift action by cleaning the wound, controlling the bleeding, and applying a sterile dressing. Over-the-counter pain relievers can also be taken to ease the discomfort. However, don't underestimate the situation. If the pain or bleeding is severe, if you haven't had a tetanus shot in the last 10 years, or if you see signs of infection, seek medical attention immediately. Remember, your health is important. Don't take risks when it comes to potential infections, and always seek professional help when needed.